Thank you so much, and thank you for inviting me to speak today. It's always exciting to see sleep included in public health discussions. It's taken us a while in the sleep field to become included with diet and exercise, but I think we're making good progress. So I just want to start out with starting from a broad perspective, this idea of sleep being an essential biological behavior that humans engage in, but so do most animals that we've observed. So everything from tiny fish exhibit behavioral signs of sleep, all the way up to the largest mammals like elephants. Now, there are differences in the duration of sleep in terms of, large plant-eating animals like elephants. They need a lot of time to consume enough calories to maintain their body weight. And so they don't have as much time for sleep. So they only sleep a couple hours every day. Then you have on the opposite side of the spectrum, the brown bat. They can only effectively consume their food source at very specific times of day. And so they have very long sleep patterns. They sleep 23 hours of the day and eat for an hour or two. And so you see this spectrum of duration, but also of timing. And so we'll talk about that as well. So where do humans fall on that continuum? Well, it depends on how old we are. So everyone who's had a newborn knows that in the beginning, most of what babies do is sleep. So typical is 14 to 17 hours every day. Now we know that this is not consolidated at first, right? It's fragmented and it's mixed with feeding sessions. There's just not a lot of wake time there, right? Because they spend so much time feeding or sleeping. And as we age, this duration, this sleep need decreases over time until we're in our adult years here, where the range is about 7 to 9 hours. So we know that that's what an adult human needs to function at their best and for optimal health. Now, what happens during those 7 to 9 hours that we're sleeping? For a long time, researchers thought sleep was just this quiescent state and that not much was happening in the brain while we were sleeping. And that's why it was so ignored for so long. It's only in the past 100 years that really people have started to focus on studying what's happening during sleep and why is it so important. So those early studies, what they did was they hooked up electrodes to human subjects' skulls, and this amplified the electrical signals from the brain. And it allowed researchers to be able to measure them, whereas they couldn't prior to this technology that enabled this amplification. And what they did was they just brought in people and had them sleep and looked at the brain over a night of sleep. Seems like a very simple study. At the time, it was actually hard to get it funded because the cost of the paper for the output of these EEG readings was very expensive because you had to measure brain activity for about 8 to 9 hours. That was a lot of paper back in then. And a single paper was 1 minute of a recording. Anyway, so what they found was that every adult that they were looking at looked remarkably similar in terms of the patterns of the brain activity over the course of the night. So what we see is that when you are falling asleep, you're in this sort of what we call stage 1, where you're kind of asleep, but you're kind of awake. If someone said your name, you could probably respond, but you might be a little bit slow. And then you get deeper into sleep. We call that stage 2. And that's when it would be hard to respond to external stimuli. Like you're actually asleep at this phase. And you spend a lot of your time in stage 2 across the night. As you go deeper into sleep, you go down to what we call slow wave sleep. This is also called stage 3 sleep. And this is called slow waves because you have these large, slow, synchronous brain activity patterns happening. And slow wave sleep is really, really important for cellular repair, recovery. It's really when your body is taking this time to repair, recover, and maintain itself in a healthy state. So you really need this very deep slow wave sleep, as it's so important. There's hormones that are released during this time. And you're in that for a little bit, and then you kind of cycle back up through stage 2, and then you go into your first bout of rapid eye movement sleep. This is shown here in the black. Rapid eye movement sleep is a very bizarre state where your brain is incredibly active. If you were just to put someone in a scanner and look at their brain when they're in REM sleep, you wouldn't be able to really tell much difference between what that looks like and an awake brain. Very similar, very active brain during REM, but the body is completely inactive. We have what we call muscle atonia, a lack of muscle tone. You're essentially paralyzed so that you don't act out those dreams and that active brain that you're having during REM. And then after you've been in REM for a bit, you cycle back down, you have some more slow wave sleep, and you cycle back through this over the course of those 7, 8, 9 hours. In general, you experience the most of your slow wave sleep at the beginning of the night, in the first third of the night, and you experience most of your REM, rapid eye movement sleep, in the last half of the night. And so it's important to get the full 7, 8, 9 hours you need, because there's different things happening physiologically across that time period. Now you will see, though, it's a range. So adults, it's not a specific number because not everyone has the exact same need. We know that most people need somewhere between 7 to 9 hours, but there's certainly nothing wrong if you're someone that you can function well on 7 hours. That's what you need, or 8 or 9. It's not, it's just like any biological system. We're not robots. There's just this individual variability in how much sleep we need. Now, there are the rare few of us that seem to function okay on less than 7 hours, but it's very rare. So a lot of people think that they're able to function well on less than 7, but we find that they're actually not functioning optimally. They're usually getting by with the use of alarm clocks, caffeine, other substances to help them maintain alertness. Whereas if you're getting 7, 8, 9 hours, you should be able to maintain that alertness without the assistance of stimulants or other things. Now, as I mentioned, there's also individual differences across the animal kingdom in sleep timing, right? Some animals are nocturnal, others are crepuscular, meaning they're active during dusk and dawn. And then we have diurnal animals, which are active during the day and sleep during the night. And that's what humans are. We're active when the sun is up and we sleep when it's dark. But we do know that there's individual differences in when each of us function best. So we have early birds, which we call morning chronotypes. And these are individuals that are just naturally up early. They can think well in the morning. They get the most done in the morning. They're very productive. And then as the day goes on, they start to get tired. They're ready for bed at 8 p.m. They can't function well late at night. They go to sleep early. Then you have your intermediate types that are just sort of in between. And then you have night owls, which we call evening chronotypes. These are individuals that are naturally very productive, very alert and awake in the evening to nighttime hours. They prefer a later bedtime. They don't really get tired until maybe midnight, and they naturally wake up at 8 or 9 in the morning. They're not functioning at their best super early in their morning. They're on this more delayed time frame. Again, nothing wrong with being one or the other. These are just biological differences that we think have an origin back when we were ancient human small groups, maybe 150 people living together, it would make sense to have a range where some people are very alert early to protect the group from predation or other issues, and then have a group that's more alert and active at night so that you're covering more time for protection of the group. So that we just have, based in our genetics and other factors, these individual differences in the timing of sleep as well. Now, in modern society, the schedule seems to be more aligned with the early birds. Most work schedules start at 8:30, meaning you have to usually leave your house by 8, which means you have to get up at 7. And this is not in line if you're someone that's an evening chronotype or a night owl. That can be very difficult, which can lead to less sleep, poor sleep quality, and subsequent health problems. So with COVID and this increase in more flexible work schedules, more work from home, it may be one of the positives that comes from this is that the night owls can potentially create a schedule that's more in line with their biology. And I just have this slide to show that there are very successful people with very different sleep schedules. You don't have to be someone that only sleeps 4 hours and wakes up at 4 a.m. to be successful. That's a myth. Some people, say like you're just a better person if you're an early bird, or you're somehow superior if you don't sleep a lot. That's simply ridiculous. Sleep is just like eating. Everybody needs sleep. And so everybody from CEOs to the president, they're getting their 7, 8, 9 hours, and they're very successful. So what we've been covering so far are the factors that underlie your sleep need. This is really your genetics, your biology, and it's controlled with 2 processes. One is a homeostatic process where when you wake up, you've just slept, so your drive for sleep is really low. But as you're awake across the day, that drive for sleep increases, just like hunger. If you've just eaten a meal, you're not as hungry, but the longer you go without food, the hungrier you get. So that's a homeostatic drive for sleep. And obviously the peak of that drive is right before we go to bed at night. And then that drive decreases as we sleep across the night, and then the cycle repeats. There's also another process, that's the circadian rhythm process. This is the sun, the light-dark cycle. And since we're diurnal, we have circadian factors that promote alertness during the day, and then others that promote sleep during the dark. And so these 2 work together to help establish our sleep need. But what about sleepability? So we know that most humans need 7 to 9 hours, but are they able to sleep 7 to 9 hours? And there's actually a lot of reasons that could be difficult for someone. You might suffer from a mental health issue like depression or anxiety that makes it very difficult to fall asleep or stay asleep. You might suffer from chronic pain that makes it hard to lay in a bed over 8 hours in a night without waking up. Perhaps you're on prescription medications that have side effects related to sleep-wake issues, or you have to use the restroom over the course of the night. You might suffer from a sleep disorder like obstructive sleep apnea, where your airway becomes obstructed during sleep and you wake up a lot during the night gasping for oxygen. You might work shift work, where you're now trying to go against your biology. You're trying to work during the night and sleep during the day, which is completely out of sync with what humans are supposed to do. That could make sleep very difficult for you. So there's a lot of reasons why people may not be able to sleep that 7 to 9 hours. And typically, this is when you would want to see a healthcare provider, ideally a sleep specialist, but those unfortunately aren't available in a lot of hospitals or clinics. And so you'd want to really talk to your therapist or your physician or your nurse about ways that you could potentially improve your ability to sleep. However, the third factor is giving yourself the opportunity to sleep 7, 8, 9 hours. And this is what we're seeing as an issue, particularly among young adults, right? There's nothing wrong with their ability to sleep. So I've done studies in Rutgers students where we make them stay in bed for 10 hours and we look at how much sleep they get. They're able to sleep more than 9 hours at a time, right? Because they're so sleep deprived. So the ability to sleep is there, but they're not getting the sleep they need because they're not even in bed trying to sleep for 7, 8, 9 hours, right? And there's a whole host of reasons that adults curtail their opportunity for sleep. And certainly middle-aged adults who have kids, this is really, really challenging. The primary predictor of time spent sleeping is time spent working. The more you work, the less time you have for sleep. The second factor we identified was commute time. The longer your commute, you're extending your workday. Well, that's less time for sleep. In terms of kids, particularly when you have 3 or more kids, that significantly impacts your opportunity for sleep. And then one of the more recent issues that's become very important is social media, screen time, and sleep. 95% of people use their phone right before they go to bed. It's the last thing they do before they go to sleep, and they often keep it on the nightstand right next to their bed, such that when they happen to wake up during the night, 50% of people will immediately check their phones if they wake up. And then when we wake up for the morning to start our day, 80% say they immediately check their phones when they wake up. Now, this is an issue for a couple of reasons. The first is that we know that social media apps, particularly, are designed to capture our attention and keep us on the app as long as possible. And when you ask people about using social media, it's very common for people to cite this idea of losing a sense of time, losing track of time. They're laying down, they're ready to go to bed, and they'll say, I'll just check Instagram for a couple minutes because I'm not like super tired yet. So they're laying in bed, they'll open an app, and all of a sudden 2 hours have gone by. And now their sleep opportunity shrinks from being 7 hours to being 5 hours because they have to wake up to start classes, school, work, childcare, whatever it is, right? And so time spent on these apps can really curtail this opportunity for sleep. The other issue with the phone is that it emits light from the screen. And so we always tell people now, if your phone isn't automatically adjusting the brightness level, manually go in and bring down that brightness level as low as it possibly can go if you're going to look at your phone late at night or right before bed. Because the problem with light being emitted from the phone is that our brains evolved to see light as a signal for the sun, right? We didn't evolve to have computers held in our hands emitting bright light. And so what happens normally is that we have a signal called melatonin. And melatonin is released when our eyes are not exposed to bright light. So during the day, melatonin levels are very low. And then in the evening, when it's dark, we see an onset, a melatonin onset. This is the point in time where melatonin starts to tick up. And it goes up and peaks during the night and then decreases as morning comes on and then stays low again as we're exposed to light. What happens, and you can see in this bottom graph, is the normal melatonin is this dark black square line here. But if you're exposed to bright light, you prevent that melatonin signal from coming up. And this is a signal that communicates with the sleep-wake centers of the brain. It's telling the sleep-wake centers, hey, you can turn on and go to sleep because it's dark and we're diurnal animals and we should be asleep during the dark phase. So melatonin is a circadian rhythm signal that works with the sleep-wake areas of the brain to assist in helping us fall asleep and stay asleep. If you're exposing your eyes to bright light, the brain can't distinguish between that and bright light from the sun. And it says, well, this is light, so we better shut off the melatonin or prevent it from increasing. And this can lead to a difficulty falling asleep from an ability perspective. Now, when we ask Americans, are you getting enough sleep? About a third report that they're habitually getting less than 7 hours. So on a typical night, they are not meeting that minimum amount of sleep that we need to be able to function optimally. And this became more of a public health issue in 2017 when the CDC declared that there was a crisis related to a lack of sleep among Americans. And this was the result of, first of all, that large percent of the population who was not getting enough sleep, but also because data started coming out showing that short sleepers, those individuals that habitually get less than 7 hours, were at increased risk for several chronic health diseases. So individuals who are short sleepers are more likely to gain weight over time and have a BMI greater than 30. They're more likely to report being physically inactive, so not meeting the physical guidelines. In this case, they're more likely to report no physical activity in the last 30 days. And they're also at risk for cardiovascular disease, heart attack, coronary heart disease, stroke, certain cancers, arthritis, depression, and diabetes. And we'll talk a little bit more about those as we go forward. But it was this population data that kept coming out with consistent evidence showing, hey, individuals who are not getting enough sleep are at increased risk for all of these health issues. We need to bring this to the public attention and get them to prioritize sleep and understand that it's important. It's not something you can just sacrifice to do other things. So as I mentioned, short sleep is associated with weight gain over time and risk for obesity, as well as diseases that are associated with obesity, like hypertension and type 2 diabetes. And this relationship between sleep duration and weight gain is not only present in adults, both young and middle-aged adults, but also you see it in kids as little as preschool. Kids who are short sleepers in preschool are more likely to exhibit weight gain and a risk for obesity later in their school-aged years. You also see it in adolescents, the same pattern. So it's a very consistent finding. And when laboratory studies have been done to look at why is this happening, what we see is that when people are not sleeping, they're awake, right? And when they're awake, they have access to a lot of calorically dense, unhealthy foods. And they consume a lot of extra calories in that time frame where they're awake instead of being in bed asleep. We also know that lack of sleep alters appetite regulating hormones. Particularly, the work has focused on ghrelin, which is a hunger stimulating hormone released from the stomach. And individuals who are short sleepers have an increase in ghrelin. So that drive, that hunger drive or signal is increased when you're sleep deprived. We also see changes in the reward system of the brain in response to food cues, where cues for food, like a McDonald's sign or a picture of a cake, those are more salient and rewarding to brains that are sleep deprived compared to brains that have been well rested. So there is both a behavioral aspect, you're just more time awake in an obesogenic environment, but there's also this physiological drive for consuming unhealthy, calorically dense foods. I also mentioned that short sleep is associated with cardiovascular disease. And normally what happens when you go to sleep is that you experience blood pressure dipping. And dipping represents about a 10% drop in your blood pressure. There's this shift in autonomic function where everything slows down and you get in this very restful state when you're sleeping. Respiration is slow, heart rate is slow, everything is just sort of quiet. Now, when you're in REM, you actually see increases in cardiovascular output, but during the non-REM stages, stage 1, 2, and 3, that slow wave stage, everything is very quiet. And it turns out that dipping is really important for heart health. And so when you're not getting a full night of sleep, you're not experiencing that nice blood pressure dipping for 7, 8, or 9 hours. We also know that nocturnal blood pressure levels are very predictive of cardiovascular morbidity and mortality. So doctors have started signaling like, yeah, we can measure blood pressure for one time point when people come into our office or our clinic, but we really need a full picture of their blood pressure profile. So a lot of physicians are starting, and healthcare providers are starting to shift to collecting 24-hour measures of blood pressure to see what happens over the course of the day and what's happening at night, because it seems like blood pressure at night might be particularly important for heart health. Again, if you are sleep deprived, you're not getting enough sleep at night, you're going to have an increase in your blood pressure. And sometimes we see that increase stay elevated the following day. So it's not only that during the night you're not seeing that dipping, but there's this lingering effect the following day where your blood pressure is still elevated. In terms of type 2 diabetes, we know that a risk factor for type 2 diabetes is when the body becomes less sensitive to insulin. Therefore, the body has to start compensating and making these changes, and it becomes this vicious cycle where the body just becomes less and less sensitive to insulin signaling. If you bring someone into a lab that's healthy, that is not pre-diabetic or diabetic, and you sleep deprive them for a week, you see a drop in their insulin sensitivity. In certain cases, it's significant to a level where they will look pre-diabetic. So because they're not getting enough sleep and all of the physiological processes that are happening during sleep in terms of hormones that are released, you see this decrease in insulin sensitivity that's happening. And a lot of work is being done right now to look at what are the mechanisms of this. How is this happening that you see this dramatic decrease in insulin sensitivity after even a week of short sleep? What about immune function? So this is a very important topic, certainly during COVID. And it's something that I think a lot of people instinctively know, but it's important to keep at the forefront of your mind so that you prioritize sleep. This was a study that was done in 2015, and they brought healthy volunteers in and they tracked their sleep using a device for a couple of weeks. So they could see habitually how much sleep were these different individuals getting. And then they purposefully exposed the participants to a virus. They inhaled it into their nose. And they asked the question, who's going to get sick after this controlled exposure to a virus? And what they found is that individuals getting 5 or 6 or 7, like less than 7 hours, were at significantly higher risk of catching a cold after that virus exposure. And so keeping your immune function healthy, keeping your defenses up and protecting you from catching illnesses, it's really important to maintain 7, 8, 9 hours of sleep. If you're getting less than that, you're making your body and your immune function more susceptible to colds. There's been other work that's looked at infections as well, with similar findings. We also know that sleep prior to a vaccine can impact how effective that vaccine will be, how many antibodies will be produced after you've had the vaccine. So if you're going into your COVID shot or any hepatitis vaccine, you want to make sure you're going into it well rested, having had good sleep, to optimize your body's ability to create those antibodies, that defense against the pathogen. What about from a cognition perspective and the brain, mood? This is one of the first things that people notice when they're not getting enough sleep. They become irritated, short-tempered. We know that if you have a large stressor, something majorly stressful, sleep deprivation doesn't have a huge impact. It's going to be very stressful, whether you've had good nights of sleep in the past or not. But where we see differences are those mild to moderate stressors, those just like little irritants that if you're well rested, you can just handle, like you can just accept and cope. But if you're sleep deprived, those things can be very exaggerated and stressful and hard to handle. We also know that being sleep deprived just makes us feel mentally exhausted, and it's hard to carry out cognitive tasks. Specifically, sleep deprivation impairs sustained attention. So you can't pay attention to a talk like this for an hour. It's hard to accomplish working memory tasks where you have to keep things in your mind and manipulate them for calculating or planning. And we also know it slows down processing. So you might be able to do things you've always been able to do, but if you're sleep deprived, you're just going to be slow. You're just not going to be able to do them as quickly. And this is the same for reaction time. We know that reaction time dramatically declines when you're sleep deprived. So you're just not able to react as quickly as you normally would. In terms of mental health issues, poor sleep quality and short sleep duration predict future depression and anxiety and are often comorbid with those issues. So many people that seek therapy for depression and anxiety also report sleep issues. Now with depression, it's interesting because you see sort of two phenotypes. Some individuals report insomnia, where they have trouble falling asleep and staying asleep, whereas others report hypersomnia, sleeping 11, 12, 13 hours a day, sleeping all day, taking lots of naps. So it's important to really understand what is the particular sleep problem happening in individuals with depression. Many people with anxiety, one of the main reasons they seek medications to treat their anxiety is because they cannot fall asleep. They just have these anxious thoughts and rumination happening when they're trying to sleep. And so they often will seek medication to help them with that. It's really important for healthcare providers to talk about these sleep issues with their patients and try to improve them because it improves long-term outcomes. So individuals with depression and anxiety, if they can treat their sleep issues, they're more likely to be in remission long-term in terms of their mental health issues. So we know that we can help facilitate treatment if we take time to address the sleep issues as well. And then how does it affect our impact to work? We know that individuals with poor sleep are less productive. They're more likely to miss work. They're more likely to be late for work. And so all of this has economic impacts. So it's not only a health issue, but it also is an economic one. And another thing related to that is accidents. Part of the reason that chronic sleep loss is so problematic is because you don't just fall asleep in the middle of the day, right? You don't just pass out at your desk for an hour, because that's what people think of as narcolepsy. But instead, the way it works is you just become you have this instability happening where you're awake and you're fine, and then you have a nod off, right? Where you fall asleep for a second, then you come to, you're like, I'm fine, I'm awake, and then you fall asleep for another second. And this creates a very unstable system that can lead to workplace incidents, injuries, and car accidents. So we know that in the United States, 250,000 drivers fell asleep at the wheel. 54% of adults report drowsy driving in the last year. 28% report falling asleep completely while driving. And we know that drowsy driving is a significant factor in many, many crashes. Sadly, fall asleep crashes are often fatal because the driver doesn't even attempt to brake prior to impact. And so the impact is often much more serious because the car is not slowing down prior to it. A lot of sleep professionals don't love the term drowsy driving because it kind of makes light of what's happening. Instead, a lot of people think what it should be called a fall asleep crash. And there's been several cases in the news, high profile accidents that are related to drowsy driving. But one of the limitations is that there's no test. It's not like you can have a breathalyzer that proves somebody fell asleep at the wheel. So instead, it's kind of like a puzzle. You have to put together the nature of the incident and what was happening prior to the crash. How long was the driver awake? What time of day were they driving? If it's in the middle of the night, that's more likely to be a fall asleep crash. So you kind of have to look at all these different factors to even establish that something is a fall asleep accident. And so for many law enforcement officials, they don't have the time or the resources to do that. And so we think that it's likely a much higher statistic than what's often reported, because so many crashes are the result of drowsiness, fatigue, or sleep, but they aren't reported that way. Another aspect of chronic sleep restriction that's problematic is there's a discrepancy between how you're functioning and how you're feeling. What we see in humans is that we get used to things that happen incrementally over time. So if you don't sleep at all, you get 0 hours of sleep, you're going to report, I'm tired, I'm very sleepy. But if you're just going night by night, only getting 4 hours a night, at first you're like, yeah, I'm tired. But then over a few days, you're not reporting additional sleepiness. You're just kind of like functioning at a new level. And you're like, okay, this is just the way it is. This is how I function now. You don't sense that you're actually, every day that you're getting less and less sleep, you're getting worse and worse and worse. But we do see that when we objectively test you. So if we put you in front of a computer and have you do computer tasks, every day that you're getting 4, 5, 6 hours of sleep, you're getting worse and worse and worse in terms of your attention, your working memory, and your alertness levels. So there's this difference between how you're actually functioning and what you're reporting. where we're just not good at sensing that we're getting worse and worse. And so this is why a lot of people think that they're fine, that they can function off of 4 or 5 or 6 hours. So what should we do to help if we're someone that's having issues with sleep? Obviously, we advocate for behavioral changes as a first line of defense. And then medications are available if needed. But oftentimes, individuals that are taking sleep medications do not have good sleep hygiene. Behavioral changes could be very beneficial. So the first thing you can do is schedule yourself the right sleep opportunity. Lights out, no phone. Maybe the phone is in another room. Just use an old-fashioned clock if you need to. Give yourself that opportunity and then stick with a schedule. Consistency can really help with sleep. So going to bed at the same time and waking up at the same time. Next thing is to look at your environment. Is it conducive to sleep? Is it dark? Do you have curtains or blinds that block out any light that can come in? If you covered lights emanating from various electronics, remove the TV from the room, remove computers from the room. Is the temperature cool enough? The optimal sleep temperature is about 67, 68 degrees. Often people have a much warmer sleep environment that can hinder your ability to sleep. Obviously, a comfortable mattress and pillow is critical as well. The other thing you want to do is only connect your bed with sleep. So you want to refrain from engaging in waking activities like eating, doing work, being on your phone when you're in bed, because you want your brain to only associate your bed with sleep. You can also create a bedtime ritual 5, 10, 20 minutes before bedtime, where you power down your devices, stop exposing yourself to bright light, stop engaging in any activities that would produce stress, anxiety, or excitement. And then you want to limit your intake of stimulants like caffeine. Some people are more sensitive to caffeine than others, so you'd have to really think about yourself. Are you someone that's hypersensitive to caffeine? If so, probably don't want to consume any after noon. If you're someone who's less sensitive, maybe you stop consuming at 2, 3, or 4 in the afternoon. If you have trouble falling asleep, one of the biggest mistakes people make is they try to overcompensate. So like, oh, I'm not going to be able to fall asleep. I always have trouble with that. So I'm just going to get in bed really early and lay there and hope that I fall asleep. Well, what happens is you start laying there and you start getting anxious about the fact that you're not falling asleep. And now your brain is associating laying in bed with anxiety and stress. And so you don't want to do that. You really want to wait until you're tired and you really can think you can fall asleep. Avoid naps, especially in the afternoon. This isn't as big of an issue for individuals in the workforce, but certainly for college students, we have to work on napping. Again, track your caffeine and light exposure, and you may just need to shut down a little bit earlier. Give yourself more time to calm down. If you're having trouble waking up, make sure you're getting enough sleep. You might just be tired because you're not giving yourself enough time for sleep. And one of my big things is no snooze alarms. Be honest with yourself. What's the last possible minute that I can wake up? And that's your alarm clock. All you do with snooze alarms is fragment those valuable 10, 20, 30 minutes of sleep at the end of your sleep period. You don't need to do that. Just set one alarm and wake up at that time. If you wake up and you feel very groggy, the best thing you can do is expose yourself to the sun. Go to a window, go outside, hit yourself with natural bright light, and that's going to really stimulate those circadian signals that are promoting wakefulness. It's daylight, it's time for us to go. These are signals that will help your brain get the memo that you need to be up and awake. If you have trouble staying asleep, once you fall asleep, you want to make sure you manage your food and fluid intake so you're not waking up a lot to go to the restroom. And if you do wake up, don't look at your phone. Don't expose yourself to bright light. If you really can't fall right back asleep, get out of bed. Go sit in a chair. Read an old-fashioned boring book. And wait until you feel tired again. And then get back into bed. Again, we want to limit the connection between I'm in bed, I'm not sleeping, this is stressful. So if you're not sleeping, get out of bed, do something boring, and then get back into bed when you're feeling tired. Obviously, because phone use is so linked with sleep timing, reducing the addiction to your phone would probably greatly benefit your sleep habits and your sleep duration. And so there are some ways in which you can cut back on your phone use that are out there, and we always encourage them for individuals struggling with sleep. And then this is just a bit about caffeine, because some people don't think about caffeine as a psychoactive drug. They just think of it as a food or a beverage. It is a drug. It activates your brain. It stimulates wakefulness and alertness, which is why we all use it during the day. But you have to consider that if you're someone struggling with sleep, that could be having an impact on your ability to sleep. So it may be worth taking a minute to think to yourself, how much caffeine am I consuming in a day? When's the last time I'm typically consuming caffeine? And how could I start potentially cutting back a bit? You wouldn't want to cut back all the way, because then you could have some withdrawal symptoms, but you could certainly start to taper down the amount of caffeine you're consuming and see if that helps with your sleep. So that's all I have. We can shift to the Q&A portion, but just this idea that a healthy lifestyle will also promote sleep. Obviously, a healthy diet, exercise, stress management will also all be great for your sleep as well.
Well, thank you so much, Dr. Spaeth. This was really great. The information that you provided today, I'm pretty sure can be helpful for all of us. Sleep is essential to part of our lives. So I do have a few questions here, really good questions, actually. What stage are you in if you sleepwalk?
Oh, great question. So you're in usually slow wave sleep. People think rapid eye movement sleep, but that's when you're paralyzed. So if you're sleepwalking, you're usually in slow wave sleep.
Great, thank you so much.
Yeah.
Another one here, are night owls versus early birds more tied to biology/genetics or practices? I have often heard you can become a natural early bird if you just go to bed early.
You can shift. If you're a night owl, you could certainly engage in certain behaviors and manage light exposures to start to shift yourself a little bit, but you probably will never be able to shift yourself to an early bird. You might just be able to improve it to like more of an intermediate type.
Great, thank you.
Yeah.
How do naps affect, and I think you kind of touched on this before, but how do naps affect sleep rhythms or melatonin levels? And if someone takes melatonin at night, does that delay the decrease or cause a spike and then normal downward level?
Okay, so first the naps. So naps you can think of like if you eat a snack before dinner, you're not going to be as hungry for dinner, right? Your homeostatic drive or hunger for dinner is going to be less. And so that's kind of what we see with napping. If you take a nap late in the day, you're not going to be as hungry for sleep at night. And what we really want is a strong drive for sleep at night. We want to consolidate good sleep at night. And so that's why it's important to limit the amount of naps you do and only use them strategically when you absolutely have to sleep during the day, because you don't want to get in this cycle where you're napping, then you can't fall asleep, you're not getting enough sleep at night, so you're tired the next day, so you're napping, which is a cycle a lot of people get into. In terms of melatonin really depends on when you take it. So if you're someone that wants to shift your bedtime earlier, melatonin can be useful because it can cause that onset to occur earlier if you take it at the right time. Taking melatonin right when you want to fall asleep is not going to really be beneficial because your natural melatonin levels are already high enough to signal to the brain that it's dark, it's time to sleep. And so melatonin is really better for shifting the timing of sleep. Like if you're a shift worker or if you're traveling and you're experiencing jet lag, it's useful. But for like trying to just fall asleep immediately, it's not going to be as helpful.
It's good to know. Thank you.
Yeah.
All right. Is sleep position, flat on back, side sleeping, adjustable beds, and zero gravity an important factor in a better night's sleep?
Oh, that's a good question. I actually don't know if they've done, randomized trials to like compare different sleep positions. I know that, in certain cases, pregnancy or obstructive sleep apnea, that laying on the back can be detrimental to your sleep because, you're putting pressure on the spine if you're pregnant, or in obstructive sleep apnea, that's when the airways can be closed more easily and you have a lot of snoring. But I don't know in the general population if they've really compared positions.
When someone is short on sleep for one night, is it better to sleep longer than normal the following night, or to continue our regular schedule of sleep?
Great question. I kind of go in the middle. So you wouldn't want to like let yourself sleep in super late because that could potentially throw off your circadian rhythm, but it would be totally fine to allow yourself a couple extra hours the night after you didn't get good sleep. And I think, ideally you would advance your bedtime by a little bit, like an hour, go to bed an hour earlier, and then you'd let yourself sleep in an hour later, just so that the whole sleep period just kind of gets expanded rather than dramatically shifting one way or the other.
Are the over-the-counter sleep aid pills like Unisum safe?
Yeah, but they're supposed to be used short term. That's always the thing, right? So, antihistamines, Tylenol PM, those will certainly help you fall asleep. But what we see with things like Ambien, for example, they help with sleep, but then when you go off of them, your insomnia issues can return. So you want to use it in the short term, but ultimately you really want to try and adjust these behaviors to try and get your natural sleep better.
Well, makes sense. Something that I feel like I struggle with, this is another one here. What are your recommended strategies in handling jet lag?
Yeah, jet lag. So there are these great calculators online where before you travel, it'll tell you how you can start to adjust your clock. So you just start to adjust your sleep timing before you even leave. And then it tells you when you're traveling, like when to eat and when to go to sleep to get your body on the new time as quickly as possible. So there's these really nice calculators where you put in where you are and where you're going, and it helps you figure out how to adjust your sleep to adapt. Also, melatonin, that's when it can be useful because it's going to help your body get the signal of darkness for the new time you're going to, since your natural melatonin may not have shifted as quickly yet.
That's really good to know. Thank you so much for that. Why do some people act out things in their dreams, such as move around or talk in their sleep?
Right. So most times, sleep talking, sleepwalking is happening during slow wave sleep. And we don't really know why that well, but we do know that if you've been drinking or if you're sleep deprived, that's when we see sort of more slow wave sleep. And that can increase your risk for these, what we call parasomnia issues, like sleep eating, sleepwalking, sleep talking. For most people, they happen in childhood because in childhood, there's this stronger slow wave sleep happening. Kids, when they're asleep, you cannot wake them up. And most people grow out of it. But again, if you're stressed at work, you're not getting good sleep, you're really sleep deprived, you're maybe drinking, all of that can increase your risk for those kind of issues.
Okay. How does aging affect sleep?
Aging affects sleep in multiple ways. That nice melatonin rhythm that you see in young middle-aged adults, as we age, the amplitude of that gets smaller. So the signal just isn't as strong as we age. So that's from a circadian perspective. The homeostatic drive becomes a little bit dampened. And a lot of older adults, they may not need as much sleep. Their recommendation is 7 to 8 hours. So we know that there's some change in sleep need as we age as well. And then there's so many comorbid issues as you age. You're more likely to have a chronic disease, pain, and so all of that can also be challenging for sleep.
Yeah, thank you. I have one more question, and because I know I want to be respectful to everyone's time, but as well as your time. I know you have a meeting coming up.
Yeah.
The sleep in association with cardiovascular health. If we can go back to that slide, if people improve their sleep, can this lower their risk of heart disease?
Yes, there have been studies, intervention studies, where you can improve if you take someone with like pre-hypertension and you extend their sleep and improve their sleep, you can decrease their risk for hypertension and get the blood pressure normalized. So there is some exciting pilot data suggesting that.
Okay, great. Well, I do have a few more questions, and again, I have to be respectful for your time because I know you have another meeting. If anything, I could send you these questions. Maybe.
Yeah, of course, I'd be happy to email or help. Yeah.
Sure, thank you. So I just want to thank everyone, for joining the webinar today. Thank you, Dr. Spade, for this valuable information. Again, as we know that sleep is very essential and it's what helps get our day going. Thank you again. And please look out for the evaluation. There will be an evaluation that will be sent to you. I'll also send it just in case you did not get it. And I'll also upload the handout. I upload it in the chat, but just as backup, I will send it over to all those who attended the webinar today. Again, thank you again, Dr. Spade. Thank you for everyone joining and all of your wonderful questions. And see everyone soon.
Bye. Thank you.
Take care.